Hello, my name is Juan Arias. I'm talking from Madrid, Spain, and I'd like to thank Dr. Marie Salama and Dental XP for the possibility of being here and sharing my cases with all of you. My favorite topic is the reconstruction of the aesthetic zone, and that's what we're going to talk today. We're going to talk about a young, nice woman who came to our office with a big aesthetic problem on 21. But before we start with the case, I'd like to make a small reflection on what white and pink aesthetics mean to me. When we talk about white aesthetics, we talk about the crowns, the final crowns and the provisional crowns. Final crowns are beautiful. As you can see in the picture, we can make lots of pictures, lots of different angles, lots of different shapes, color. Everything is nice on the final picture. But we have to think that the final crown is just the result of the provisional crowns. When everything has finished on pink aesthetics, when we had reconstruct all the tissues, all the hard and soft tissue, and all of them are on the right position, then we start playing with the provisionals. We can make lots of provisionals. We can make natural provisionals, or we can just try to copy the tooth we want it to be there. But we have to try to figure out that the provisional is the one who's going to guide the tissue to the right position in which we want. So we begin working with the provisional, working with it, working with pressure, more pressure, until the tissues are just on the right position. Once we've got it there, we work on the final crown. So, from my point of view, white aesthetics and pink aesthetics work together. When we place the final crown, we have to be sure that the tissues are just on the right position. We can make lots of things with pink aesthetics. We can reconstruct, we can gain a lot of volume, we can remake papilla, we can redo the hard tissue. But once we've finished with the pink aesthetics, that's the moment in which we begin the work with the provisionals. So, from my point of view, provisionals are the key of the final treatment. That is very important. We can try to change the position of the tissue, but the provisionals will guide those tissues. The case we're going to talk today is this one. She is the girl who came to our office with these aesthetic problems. She was very tired of this situation and she wanted to change everything. We talked with her and we drew some lines so she could see really where the position of the papilla was. Okay, we didn't have any papilla. The distal papilla of 21 was absolutely lost. And we wanted to get to this final situation. What we wanted was the perfect finish, as everyone. But we talked with her and we told her the different steps of treatment we would need to get to this position. We talked about the extraction of 21. We talked about the regeneration of hard and soft tissue, the placement of an implant on 21, and the provisional and the final crown on 21. But we also told her that maybe we would need to change the position of the teeth rounding the implant. So maybe we could do some orthodontic treatment. And even done the orthodontic treatment, maybe we could need to make a modification of the gingival festoon of the teeth rounding the implant. And maybe we could finish with some veneers. What we tried to talk with her is that we had to do a lot of steps until we get to the perfect finish. And she said, well, that's okay. Sounds very good to me. But there's a problem. I'm not going to finish the treatment with orthodontic. I'm not going to finish with the final modification of the festoon. And I'm not going to finish with veneers. So think that you can only work on that tooth. When the treatment has finished, I'm only going to change that tooth. So everything was quite a little bit more difficult because we had to change the position of 22. You can see the space from 21 to 22. Too much space. We have to change that position. There's too much space, papilla won't grow. And maybe we cannot make the papilla just get to the same position of the other ones or the festoon. So maybe if we try to modify the festoon of the other teeth, we get to the perfect finish. But she said that she won't do it. So we begin with the case. Before we continue with the case, I'd like to make a question. What can we do with the help of professionals? As I was talking before, the white aesthetics, the importance of white aesthetics. I'm just going to place some pictures about that, but I think it's absolutely important to understand that treatment will only finish if we play with the tissues, and for playing with it, we only can work with the professionals. This is a case we started a lot time before, in which we placed an implant on 11 and we reconstruct the tissue, the hard and the soft tissue, and this is the ending of the pink aesthetics. When we finish the surgical phases, we get to this situation. As you can see, the gingival festoon on 11 is absolutely straight, but we've got a lot of tissue. That's great. We've got tissue enough to begin to play, and we've got all the teeth rounding the implant on the right and perfect position. So we begin with the healing abutment. The first day we placed the healing abutment, tried to make the smallest surgery as we could. We just make an incision and try to remove the tissue on the buccal zone. We didn't touch any of the papillas. We just tried to move the tissue buccally, so we will have some more volume. Okay, so that's the first day in which we make our first provisional. This is the first provisional in which we're not touching the gingiva. We're not making any pressure. The provisional is just only there with no pressure for the gingiva. We're trying to let the tissues heal, rounding the provisional healing abutment. So we leave it there for 2 or 3 weeks, and then we place our second provisional. This is the second provisional. As you can see, there's a lot of pressure for the tissue. You can see white tissue. Great white tissue which is trying to change the position, trying to be just the same as the tissue on 21. But it's not enough pressure. We know we have to do it on some steps, different situation, different days, and we wait in this situation about 2 or 3 weeks till the tissue is staying on the position that the first provisional is pressing. Okay, so we wait 2 or 3 weeks until we change the provisional. We've got the third provisional, is this one. You can see the pressure of the same day in which we place the provisional, and as you can see, the gingival festoon is being just the same as on 21. So we place the provisional in that position, and we wait again. We wait for 2-3 weeks until the tissue is perfect on that situation, and as we can see, this is the final step. The third provisional has gained all the festoon rounding 11. So the case from the white aesthetic is nearly done. The last step we have to make is just to change and put the final crown. But the final crown is quite easy. The only problem with the final crown are the colors. But on the shape that the final crown needs to have at the gingival position is just the same as the provisional we had before. So we just have to copy. As you can see in the picture, we have changed everything on the gingival festoon just with pressure. We have done a great big center papilla between 11 and 21. And the distal papilla looks quite good also. That's because we have worked on the 2 aesthetics. We have worked on white aesthetics, and we have worked on pink aesthetics. Pink aesthetics begin with the treatment and gain lots of tissue. And once we have it, we just have to make pressure, more pressure, till everything gets to the final situation. And just we have to place then the final crown. As I told you before, we can do lots of pictures, very, very nice pictures. Those are the ceramics, the shapes, the position, everything. So coming back to the case we were going to talk today, first of all, what we did is the extraction of 21 As you can see, extraction is done and the papilla is absolutely lost, but it was lost before the extraction was done. You can see the position of 22, the one we wanted to change, and we begin with the surgery. I'm going to try to introduce a new kind of surgery we're doing for about 2 years more or less, in which we try to make the regeneration of hard tissue and soft tissue at the same moment. What we did in this case was to place firstly the non-resorbable membrane. For the placement of this membrane, what we did is to separate the buccal soft tissue from the buccal hard tissue. So we made there a place where we could introduce our membrane, and we did not have to make any discharge. We did not have to make a big separation of the tissues so that the bone will try to stay there as much as possible. Once we had that, we worked on the soft tissues. Soft tissues, what we did was a connected pedicle, a connected palatal pedicle. This pedicle was coming from 27. We took it all the way from 27 till 22. And as you can see at the picture, the connective tissue was coming just from the extraction socket. It's quite difficult to understand these steps. I'll try to show you after a little bit more clearly. But once we've got the non-resorbable membrane on one way on the buccal side, and on the palatal side the connective tissue, what we did is to introduce in this case some purose all underneath the non-resorbable membrane. And once we've got all the purose there, what we do is to close the non-resorbable membrane one way, so the non-resorbable membrane is trying to reconstruct the buccal and the palatal bone. And once we've got that on the placement on buccal and palatal, what we do is to try to close all the surgery with the connective tissue, with the palatal pedicle. As you can see it there, you see that it comes from the extraction socket, and we introduce it all the way through the buccal zone between the soft tissue and the non-resorbable membrane. As I told you before, it's quite difficult to explain just with words this kind of surgery. I'm going to place a video so you can see it much better, and I think it gets quite clear then. Okay, that was the new surgical approach I tried to show you, and this is the suture once we finished with the surgical phase. And as you can see, I'm trying to share to compare the black and white and the color pictures. And what it's interesting here now is the healing of the surgical procedure. As you can see here, it's about more or less 11 days after the surgical phase. And the different days, as you can see, 11 days, how it looks like. 18 days, it looks like quite good, but you can see some yellow colors that we don't know very good how it's going to work, but everything seems to be quite good. We can see some pink rounding the yellow part, and at the 22 days after the surgic, we can see that everything is pink. There's no membrane there. Everything is quite good covered. So what we do at that moment is we prepare the professional. The provisional we made in this moment was just a provisional for the patient just for her, for the aesthetics, so she could feel that she got a tooth there and she had no aesthetic problem. But there's no pressure for the tissue, it's just lying over the tissue, no pressure for it, and we wait for it a lot of time. We leave it some months till the bone is good there. As you can see here, there's a separation between the provisional and the tissues. We can see at the lateral view that we've got enough volume. It looks quite good. The bone is working very good, but we can see also that we will need some more soft tissue rounding the distal papilla. That's where the problem was at the beginning. The distal papilla will need some more volume there, trying to make the shape of the papilla and the place on the face of the placement of the implant. We will try to make some more volume. So we wait more or less 5 months in this case until we see that the hard tissue looks good enough for the placement of the implant. So we get to the second surgery, the implant moment, and when we make the flap, we can see that we've got enough tissue there. We can see when we remove the non-reabsorbable membrane that the bone looks quite good. It's the moment for the placement of the implant. We can place the implant wherever we want. We have no problems now with the hard tissue. The hard tissue is not going to make us place the implant on a difficult or a non-perfect position. We can place the implant wherever we want now because we've got hard tissue enough. So we place the implant and we try to place another connective tissue. In this moment it's a connective tissue graft, a free connective tissue graft. There's no pedicle at the second phase, just the placement of the tissue in the position, in the situation we need more volume. We need on the distal papilla and also some more volume on the buccal side. So we place it. This is the moment of the suture once the second surgery is finished. But as I did at the beginning, where I placed the first video of the reconstructive surgery, I'm going to place another video also in which you can see the placement of the implant and the placement of the second connective tissue graft. So this is the video. This is the starting situation in which we can see the loss of the bone at the distal zone. And the new situation here with the second X-ray, you can see the amount of bone we gain.
Lost in the madness, know what's even real. I can't stay here, it's too cold. Where do I go? Now your name, it opens up my eyes. Leads me back to a day when we wore no disguise. I was yours and you were mine, and love was a game. Had no sense of time when I hear your name.
So the stability of the implant was enough for the immediate loading. And as we did, as you can see here, we did the immediate loading, but just for the placement of the tooth. What we didn't do is any pressure. We just tried to make the shape of what we wanted for the ending of the treatment. And as you can see here, the picture at the beginning of the case, we did not have any distal papilla, and in this moment we don't have distal papilla nor mesial papilla. So we knew that that was going to happen when we make a flap in which we take both papillas, both of them were going to be lost. But if we have enough hard tissue and soft tissue, we know that if we leave it time enough, the tissues will try to grow up and the papillas will begin to appear there. So we place the provisional and we'll leave it for 10 days. We've got here the picture of the healing 10 days after the surgery, and as we see, we have to leave it much more time so the papillas will get to the final position. We'll leave it about 5 months, as you can see here the picture, and we can see that the distal papilla is still far enough from the position that we really wanted, and we can see that at that moment we have changed the shape of 22. She told us that she was not going to make any orthodontic treatment, so we tried to change the shape so the interproximal point was much nearer from to the distal papilla. And as you can see at the mesial papilla is just growing. It just needs some more time. So here is the lateral view in which we can see that we've got enough volume. The volume is quite good, so it can reproduce the natural aesthetic we wanted to for the ending of the treatment. And if we compare from the beginning situation, we can see here no distal papilla, we've got mesial papilla. And the position of the first provisional at the implant surgery, when we place the implant surgery, we have no mesial, no distal papilla. We'll leave it more or less 5 months. As I told you before, we can see that the mesial papilla is growing, distal papilla needs to work a little bit more. And this is the final result of the white aesthetics. We can see that white aesthetics looks quite good. We've done the same shape we have on the teeth surrounding the implant. The color is quite good also. And the pink aesthetics of the ending of the treatment, we can see it here. We've got mesial papilla, it's grown enough, looks quite good. And the distal papilla is not at the right position where we want it to from the beginning of the case, but we can see that it's grown a little bit more. So we see here the complete finished case with the white and the pink aesthetics, and it looks quite good. The patient was really happy with the ending of the treatment, so she didn't want it to do any treatment more. But as we can see here, if we could have modified the gingival feston of 11, we could just make the same shape that we have on 21. And if we could have changed the position of 22, we could have gained much more papilla. Anyway, this is the lines of the ending of the treatment. That's what we've got on the ending, and this is the comparison between the ending situation and the initial situation, in which we did not have any distal papilla. We only have some mesial papilla. The mesial papilla is just on the same position as we started, but the distal papilla is not as good as we wanted to, but it looks quite good. So this is the natural aesthetic we wanted to reproduce. This is the ending of the treatment. This is the shapes of her lips, and everything looked just like this. This is the ending of the case. We knew that we could have done a little bit more. What we have to count all the times with the patient's opinion. Looks quite good for me. The ending, it's just to introduce a new surgical approach. It got a lot of good results for me. I like it a lot, and I hope you like it too. So thanks to all of you for your attention. It's been a pleasure for me.